Hey, this is Lucas Catton with Innovia Life, and I wanted to share another reason why MCOs, managed care organizations, are wanting to partner with us in terms of what we can offer. Now, I've shared before that I've worked, in my 25 plus years in the general healthcare space. The majority of that was in the substance use primary area, and I've been a facility owner and operator. I've also helped other people start and grow their operations as a consultant, and really part of what I saw in that space, it also led me to to design what is Innovia Life today, and specifically in the aftercare area, like what happens after somebody completes treatment, and how do we continue to help them throughout the various challenges and their needs in life and support them in that way. And most programs, in terms of their aftercare and support or alumni associations and things like that, are really focused, more on the recovery related topics. And we wanted to go way beyond that. Like, what happens when they get a new job, or become a new parent, or go through a divorce, or go through some other difficult time or situation in their life, and take a look at that as, supporting general living as part of the relapse prevention portion of it. And so I wanted to put together this scenario of what a typical 12 months of outpatient treatment might look like for someone in this space on lower level, like Medicaid reimbursement rates, and use that as an example. So starting out here, outpatient, the highest level of outpatient is usually PHP, or partial hospitalization, and that's roughly about 25 hours a week worth of care. So it's like a full time, pretty much a full time treatment, and we'll say they get often like 2 weeks of that, or 10 days approved, in which case at about $220 a day on the lower level, it's 2,200 bucks. Uh, After that, they go to intensive outpatient, or IOP. And with that, let's say they get 30 days approved. And they're going 3 days a week, um, at 3 hours a day. So about 9 hours a week worth of care. And at a lower level reimbursement of only about $150, that is about $4,500 in intensive outpatient care. After they complete that, they'll typically step down into, or hopefully step down into, regular outpatient. And if we're continuing on the timeline of a full year, by this point, they've gone through about 6 months worth of care, and the remaining 6 months step down to outpatient at roughly 26 visits at about $25 per outpatient therapy group that they attend in terms of reimbursement level. And hopefully at that same time, they're also attending therapy. So as part of individual therapy sessions, we talked about before, maybe about $80 per session times 26 weeks there. So when you add all this up over the course of a year, it's $9,430. Now that is, that's honestly, that's low. Like, if you compare that to commercial insurance, and what the reimbursement rates for all these different levels are, and employer sponsored health plans, that sort of thing, the numbers are much higher. And granted, these are a significant savings over some of the higher levels of care, costly or inpatient at detox. So I can understand why payers want to really focus on and support as much outpatient care as possible. And I would agree with that, whenever needed. And there are certainly plenty of times where people need to go and get stabilized first before they step into an outpatient setting. So not discounting inpatient care either. But as an aftercare model, what happens later? How do we continue to support them in their life and continue on making sure that they have the support and their changing needs and all those different scenarios that I talked about before? And what about beyond that? So if we introduce Innovia Life as ongoing support, not only while they're going through treatment, but minimally, let's say for another 12 months beyond that, that's only about $12 per member per year at that point. So they all get access to it. And with that, as a model to help prevent higher use episodes or readmission rates and things like that, $12 is a significant savings compared to being readmitted for another 12 months of care on an outpatient level. Now, granted, they don't always go back for 12 months, and a lot of people don't even adhere to their treatment plan if that's the case. And so they go in and out of this outpatient model without really getting the type of support after they leave that they truly need. And that's where we can step in a subclinical realm for an incredibly affordable rate, about $12 per member per year for a plan. And that's, if you look at that, that's $99,430 divided by 12 is more than 785 times the efficiency rate there in terms of aftercare and what we can wind up saving. So if 785 people get this type of support and we can prevent just one of these readmissions, that in itself is already paid for it. So, and again, what Innovia Life offers is unlimited access. So they can attend the same number of hours as like close to a PHP or IOP level in a subclinical support realm and continue on. And you can supplement that with additional therapy and additional clinical resources and things. You don't have, it's not an either or scenario. But when you provide more support over longer periods of time, over a wider range of topics in life, health and wellness, mental health and recovery, work and personal relationships, and the fact that we can create customized groups based on the needs of the populations we serve, it's a no brainer. So if you're a payer in a market and you're looking for ways to not only help save money, but improve overall health and prevent more higher readmission rates, then I'd love to talk to you. If you're a provider in one of these states, you're already in network with an MCO or several in your area, would love to be able to partner with you. All right, take care.